Assalamualaikum guys, welcome back to China Clinicals. Today we're going to be discussing about thyroid hormone. So for thyroid hormone, you need to know about the first basic very regulation concept. So we're going to start from here. Thyroid trophin releasing hormone is released from the hypothalamus, which is going to increase TSH as well as prolactin, as we have discussed earlier. It is going to act on the follicular cells, which is going to increase the level of production of thyroid hormones. Thyroid stimulating immunoglobulin, which is basically an antibody which is produced against the TSH receptors which are present on the thyroid gland. So these antibodies are going to act on these receptors, increasing the production of T3 and T4, producing the signs of hyperthyroidism. Negative feedback is when free T3 and T4 which are present in the circulation are going to have a negative feedback on the pituitary gland and as well as on the hypothalamus to decrease the production of TRH, thyroid trophin releasing hormone, which is also going to then eventually, as it also has a direct negative feedback effect on the pituitary itself, so it's going to be decreasing the release of TSH as well. So now T3 T4 levels would decrease. Then there is also thyroxine binding globulin, which binds to most of the T3 T4. When it is actually released in the blood, it ends up binding with the globulin, thyroxine binding globulin, which increases in pregnancy. Why? Because estrogen level increases in pregnancy, and estrogen increases the level of thyroxine binding globulin. Oral contraceptive pills, when are used, it also has estrogen, which is going to increase the thyroxine binding globulin. If they're bound to it, the effect of T3 and T4 would decrease because they're in their inactive form when they're bound to it. The TBG levels would decrease with steroid and nephrotic syndrome. Why? Because then this protein is released in urine. T3 and T4 are the only lipophilic hormones with charged amino acids, so they do need a specific transporter to get into the cell. How is thyroid hormone produced? The very first step is the uptake of the iodide ion with the help of the symporter, which is basically associated with sodium ion. So this sodium iodine symporter is going to uptake iodine from the blood, iodide ion from the blood. It is going to pass through the thyroid follicular cells into follicular lumen. So now in the lumen, it's going to get oxidized with the help of thyroid peroxidase enzyme. Okay, so this peroxidase enzyme is going to first of all oxidase or causes oxidation of iodide ion into iodine. This iodine is going to bind to the thyroglobulin, which actually has tyrosine residues. So this tyrosine residues is going to be now linked up with iodine. So it's going to form monoiodine tyrosine or diiodine tyrosine as well. So now these monoiodine and diiodotyrosine are going to go through the coupling process. So now they're going to produce T3 and T4 after binding to them. So how do they do that? Diiodo and diiodotyrosine are going to form T4, and diiodo and monoiodotyrosine are going to form T3 hormone, which is going to bind to this protein, and once they are released, they're going to be in their activated form. T4 is converted into T3 and reverse T3. So there are going to be certain factors to why RT3 is produced, which we're going to discuss in a few minutes. And now this helps with the help of 5-deiodinase enzyme. Now for this is the very most important part here. T4 is converted into T3 with the help of 5-deiodinase. There are multiple factors which affect it. So now I'm just going to simply highlight that for you. Glucocorticoids, beta blockers, propylthiouracil, and also methimazole. T4 can be converted into either T3 or RT3. Okay, so this is going to be inhibited by glucocorticoids, beta blockers, and then also propylthiouracil and methimazole. RT3 is going to be produced. It's going to be stimulated by glucocorticoids alongside with that growth hormone. So you need to know that that means in the time of stress mainly, or when a person is sick, T4 is going to be converted into RT3. I'm going to discuss this concept as well, which is very nicely described in UWorld's one of the questions. So it was actually one of the questions that from where this concept is going to work on. Now Wolff-Chaikoff effect is when there's going to be sudden exposure of iodine, which is going to shut off the effect of thyroid peroxidase enzyme, so T3 T4 level would decrease. So if there's going to be sudden exposure of iodine ion or iodide ion or iodine, it is going to have a Wolff-Chaikoff effect. How do you remember the drug called amiodarone, which is actually given, and you might have studied in CVS as well. So amiodarone has iodine in it, and once it is given, it decreases the production of T3, T4. What are basically the functions of T3, T4? You need to know about brain maturation, bone growth, beta adrenergic effect on heart. This is going to increase the cardiac output, systolic volume, heart rate. BMR via sodium potassium ATP is pumped, so oxygen consumption is going to increase, respiratory rate is going to increase, body temperature is going to increase. It has a diabetogenic effect. This means glucogenesis and gluconeogenesis is going to increase. Breakdown of lipids, that means that fatty acid and glycerol is also going to increase, and it also stimulates the production of surfactant in the babies. So yeah, this was the overall concept for thyroid hormone.